This is Dr. Russell Blaylock, and you're listening to the Blaylock Health Channel. Today, what I want to talk about is a subject of concern to millions of Americans. And this, like many of these so-called mysterious diseases, begins being classified as a psychiatric disorder. What I'm going to talk about is chronic fatigue syndrome. This first was recognized back in the 1980s. And people usually of high intellectual character, people who were professionals, began to present to their physicians with a constellation of symptoms. These things would be disorders like fatigue, muscle weakness, pain, difficulty getting through the day, clouded thinking, poor memory, depression, anxiety, a whole constellation of these symptoms. And usually what we see when people present to the physician with new sets of symptoms and they don't seem to be connected, it's very difficult for physicians to put that together. So almost the reflexive thing they do is say that it must be stress, it must be a psychological disorder. And they put them on a tranquilizer to see if they get better. This is almost universal, and we've gone through this with a number of disorders that later were proven to be physical illnesses. And the same thing holds true in chronic fatigue syndrome. Now, as this began to evolve, physicians began to do more intensive studies. They did EEGs, for instance, and picked up some abnormal brain patterns in the EEG, showing that there was something physically happening inside of the brain. They did studies on inflammation and found that frequently these people have elevated levels of inflammation in their body. And slowly over the decades, we begin to piece this together. And now we're beginning to recognize that indeed this is a true physical disorder. And it affects a lot of systems, that is, different parts of the body, the brain, the muscles, the organs, and can have all sorts of symptoms and signs that initially, as I said, seem to be unconnected. Now, what we've pieced together is a couple of things happen. Most of these cases fall of one of two things, either a natural infection, usually viral, or vaccination. The viral connection has been connected to viruses like HHV6, the Epstein-Barr virus, cytomegalovirus. These are the more common viruses that are isolated. And the second is vaccination. Now, vaccination, you're stimulating the immune system, trying to fool the body into thinking it's been infected so that it'll mount an immune reaction and you'll develop immunity to whatever agent you're interested in. The effect of both of these, the natural infection and the vaccination, is similar in some ways and different in a number of other ways. It's similar in that the immune system is reactive for a prolonged period of time. When you have an infection, let's say you develop a viral infection that's a flu-like infection, the first thing that happens is your immune system, your body's immune system becomes activated. We call that systemic immunity. And a whole group of antibodies and cells begin to be activated to try to seek out this invading organism and kill it. This systemic immune reaction is very quickly transferred to the brain. The brain has its own immune system. Its immune system's main cell is called the microglia. And this immune cell is a little bit different than the immune cells in the rest of the body in that it also can secrete large amounts of glutamate. And what we find is when you become systemically infected with a virus, such as the flu or cytomegalovirus, Epstein-Barr, your immune system is now activating that brain microglia cell, and if it persists too long, it begins to secrete glutamate, which is an excitotoxin. And it causes brain cells to become excited. It can start destroying some of the connections between the nerve cells, the neurons, and the brain. So if this reaction persists too long, it can do a lot of damage, not just in the body, but in the brain itself. Now, if you recall what it was like when you had the flu or had an infection, what you remember is that your muscles ached, you had a lot of fatigue, you just wanted to sleep all the time, you wanted to be left alone, you didn't want to socialize. If you try to remember things, or if you're in school and you're trying to read, you find you have difficulty remembering, putting thoughts together. And prolonged infections, you can have this sensation of being depressed or anxious, your sleep's disturbed. This is called the sleeping sickness behavior, this reaction. It was first thought that, well, that's just the systemic reaction of your immune system being activated. Well, now it's understood that it's a brain effect. It's because the brain's immune system rapidly activated. This glutamate's released, the cytokines, the inflammatory chemicals in the brain, produce all of these symptoms and sensations, particularly depression and anxiety, which is now linked to this process. Now, the interaction between this immune activation, this inflammation, and this excitotoxicity, I coined a term for that and put it in the medical literature. I call it immunoexcitotoxicity because they're intimately linked. Now, when that's activated, what happens is the brain produces a lot of free radicals. There's a lot of lipid peroxidation products, all of these things that are causing the brain to be constantly inflamed. But it's a low-grade inflammation. It's not like meningitis or full-blown encephalitis, even though it can be. Now, vaccination is a little bit different in that when you vaccinate somebody, you're doing something totally different. You're injecting not only the organism, the infectious organism, either dead or alive, but you're mixing it with an immune stimulator, something that makes the immune system react very intensely. We call that a vaccine adjuvant or immune adjuvant. Now, what this adjuvant does is it keeps the immune system reacting intensely against this viral antigen that's mixed with the vaccine. But the immune reaction we see with vaccines is very different from the immune reaction you have when you develop a natural infection. Natural infections generally enter the body through the mucosa or the lining of the nose, the throat, the lungs, or the GI tract. That's where most of your immune system is located to prevent invasion. And it produces what we call a Th1 type reaction. It's mainly a cellular combined antibody reaction. It's most efficient in getting rid of this infection. And it gives you lifelong immunity to most of these infections. Vaccination, on the other hand, is injected in your muscle, completely abnormal way of having these things enter the body. And therefore, the immune reaction is different, and most immune reactions of this type are called Th2 type reactions, and that's actually interferes with cellular immunity, one of the most important forms of immunity to get rid of these viruses. And that's why the vaccination protection usually doesn't last more than 4 years to 10 years, and then it has to be repeated. Is because it will not give lifelong immunity because of the way it's designed and the way it's injected into the body. Now, the chronic fatigue syndrome, what happens is normally when you have an infection, it's rapidly cleared from your body. The immune system turns itself off. There's a switching mechanism so that the immune system stops secreting these inflammatory cytokines and all these chemicals that produce inflammation. And then it secretes other chemicals that help repair whatever damage may have occurred during that immune attack. And so you feel a lot better, and that's why you get this almost a sense of euphoria when you get over the flu or some viral infection or bacterial infection. What happens with vaccination often is that we see that the immune reaction is prolonged. That is, that it will last as long as a year to 2 years of intense immune activation, and that the immune adjuvant can travel to the brain and produce constant brain immune activation as well, and that interferes with brain function. So you're seeing some abnormal reactions. Now, in some natural infections, what happens is the immune system is unable to clear the infection completely, and therefore the virus or bacteria or mycoplasma will persist in the body. And when that happens, this persistent, low-grade inflammation is occurring for years, decades, or even a lifetime. And that's what produces the chronic fatigue syndrome. It's now considered to be a myalgia encephalomyelitis. And what that term means is that the muscles are inflamed as well as the brain and the spinal tissue. So that it's a widespread nervous system inflammation as well as muscle inflammation with high levels of inflammatory chemicals being present for prolonged periods of time. So with knowing that you've got these two processes, one, the inability of the immune system to shut itself off, a persistent infection that keeps this reactivity going, and the vaccine effect that produces this chronic immune stimulation and will not allow the immune system to shut itself off and reverse this inflammatory reaction. In fact, this has recently been called the Schoenfeld syndrome, or ASA, A-S-I-A, and that's an autoimmune inflammatory reaction due to adjuvants, immune adjuvants in vaccines, and this produces this syndrome. Now, the question that, of course, is most in your mind at this point is, well, okay, I agree that this is an immune reaction. Most of the scientific literature now agrees with that. But what do you do about it? Well, most of the medical treatments have not been very successful. People who have a viral infection that's persistent, or a bacteria or a mycoplasma, you can treat it with antibiotics, and a lot of these people get better, get well. Or you can treat the person with an antiviral agent, and it'll get rid of the virus, and then they'll get well. The bulk of the patients, the ones that don't get well, that have chronic problems, the ones who have difficulty switching off their immune system, and those who have an immune reaction to their vaccine. So there's no living organism that's keeping the immune system activated. Now, fortunately, since the drugs don't work very well in these cases, we've discovered that there's a whole host of natural products that do seem to work. Recently, it's been found that if you give chronic fatigue patients coenzyme Q10, a large number of them will get better. Their strength returns, the muscle soreness subsides, the thinking clears up. And that's because this chronic inflammation suppresses the mitochondrial energy production throughout the body, and CoQ10 replaces and stimulates that energy production. It's also been found that if you take some of these patients, this is a rather small study, but they found if you took a chocolate that was 85% pure coca and fed it to them 15 grams 3 times a day, they had remarkable improvement in their symptoms. And that's because coca contains a whole host of flavonoids, which are anti-inflammatory, as well as some things that improve the neurotransmitters in the brain. But there's also a whole list of plant extracts that seem to help. For instance, silymarin, milk thistle component, is very potent at reducing that activity of those microglia in the brain. It's a powerful anti-inflammatory and reduces inflammation in the muscles in the body as well. N-acetyl-L-cysteine, commonly referred to as NAC. N-acetyl-L-cysteine has been shown if you give it to people who have the flu, they get well quicker, they have a less severe disease, they feel better faster, and in people with chronic fatigue, they'll also get better. Now, what NAC does is it increases the amount of glutathione in cells, all the cells of the body. Well, glutathione is one of your main cell protectant molecules. It's like a shield. And so when you develop chronic fatigue, you develop these chronic infections or viral effects, one of the things we see is very low glutathione levels. Another thing that's been observed is vitamin D3 tends to help. Now, vitamin D3 in your blood has to have a carrier protein. It carries it through the blood. It's been discovered that carrier protein, this vitamin D carrier protein, stimulates an arm of the immune system called the macrophage to be more effective at clearing viruses and bacteria and mycoplasma from the blood. And people who have chronic fatigue syndrome typically have very low vitamin D levels, and when you raise the vitamin D3 levels, a significant number of them will improve. Things like white tea, green tea extracts, they contain a product called EGCG, which is epigallocatechin gallate, and this has been found to interfere with viral replication and help clear viruses from the blood, so it aids your immune system in getting rid of these persistent infections. It also reduces the inflammatory response so that you don't have all of this high level of inflammation. A product extract called apigenin, which is found in parsley and some other vegetables, but they extract it and make a concentrate of it, and they found that it tends to reverse autoimmune reactions, which would be very helpful in this condition. Another product called bialkaline, which is extracted from a plant called skullcap. The bialkaline has been found to protect the brain. It reduces the microglial activation. It inhibits immunoexcitotoxicity. It reduces inflammation in the body. And it reduces iron-triggered formation of free radicals. Ferulic acid is another plant product found commonly in fruits, and ferulic acid calms the microglia in the brain. Two of the really big guns in this are curcumin and quercetin. Curcumin is an extract flavonoid from turmeric, the spice, and quercetin is a very common flavonoid, the most common flavonoid found in edible plants. Together, they powerfully inhibit inflammation. They're highly protective of the brain. They reduce microglial activation. They stimulate energy production by mitochondria. So they have a lot of things that they're doing that would help reverse all of the different symptoms of chronic fatigue syndrome. And of course, the omega-3 acids like DHA, EPA, components of omega-3 acid, what a lot of people call fish oils, particularly the DHA. DHA reduces inflammation. It is the main component of the membranes of all cells, and all the connections between nerve cells and brain cells contain a lot of DHA. Unfortunately, people eat very little omega-3 fatty acids, so in the Western diet, people are pretty much deficient in omega-3 fatty acids. In that same juncture, what we talk about is omega-6 oils. Omega-6 oils are things like corn oil, safflower oil, sunflower oils, soybean oil, and peanut oil. These oils are pro-inflammatory, so if you're consuming too many of them, it produces inflammation throughout the body and in the brain and will worsen this condition. Now, Americans in the typical Western diet consume about 50 times more of this type of fat than they should, so you need to cut the level of omega-6 fat consumption. Don't cook in these vegetable oils. Use either extra virgin olive oil or coconut oil to cook in. Mix turmeric with it when you cook in it. The turmeric keeps it from oxidizing, and this is very healthy. These things reduce inflammation. So I've given you a list of things that reduce inflammation, that alter this immune reaction so it can calm it down. And these seem to help all types of autoimmune diseases, including this chronic fatigue syndrome. So it requires a dietary change. Eat less red meat. Red meat has a lot of iron in it, a lot of glutamate in it. That tends to promote inflammation. If you eat red meat, always eat vegetables with it. The vegetables tend to reduce iron absorption, and they reduce the inflammatory reaction by the meat itself. Keep it from oxidizing. Avoid fluoride, mercury, cadmium, lead. All of these things tend to worsen inflammation, worsen this condition. And drink pure water. You should have filtered water that has the fluoride removed, the aluminum removed, or distilled water. Magnesium is very important because magnesium reduces inflammation throughout the body, reduces brain inflammation, reduces excitotoxicity, calms down these immune cells, and the microglia in the brain is also calmed down by magnesium. Most people in this country eating the Western diet are magnesium deficient. So magnesium supplementation is important. I like the slow release magnesium malate, magnesium citrate. They're very well tolerated by the GI tract. You don't get the diarrhea, the stomach cramping you can with some magnesium products. And the dose is about 500 milligrams a day. If you're eating your vegetables the way you should, the 5 or 7 servings of vegetables with it, then you'll get enough magnesium. So I hope this has been of some benefit in understanding this condition and what can be done about it to improve your health, help prevent ever getting the chronic fatigue syndrome, and if you have it, things that you can do that possibly would improve it. Thank you. The information contained within these programs is not intended to replace or contradict that of your physician. This information is for educational purposes only.